coordinator for mental health. The legislation was put together at the last minute. We were doing something that hadn't been done before, so not surprisingly, for a variety of reasons, there were some technical issues, and this bill hopes to deal with them. The individual who has been employed is Bill Rosamond, who seems to be well received from everyone I've spoken to from a number of different groups and points of view. I will say also that I am more and more convinced that it is essential to have an individual such as Mr. Rosamond, whose job it is to deal with this issue all day, every day. It crosses across judicial issues, police issues, mental health, Department of Mental Health issues, community mental health issues, housing issues. You can just go on. And having an individual who will focus on all of this and talk to all the different groups and try to get things coordinated, I think is going to be very successful. Mr. Rosamond would like to employ 2 people on a contract basis to help him. This legislation would permit him to do that. The legislation that was passed said that the office would be housed, whatever that means, in the Department of Mental Health. In fact, the individual was employed by the Department of Finance and Administration. And through a number of moves, his salary is currently being paid through the DFA budget. It is the position of Mr. Rosamond, of DFA, of the Department of Mental Health, and my House counterpart is at least agreeable to this, that we simply need to set up this office in the Department of Finance and Administration to further show that this entity is independent of the Department of Mental Health. And I'm told the Board of Mental Health agrees with this. So I know of a lot of support for this from a lot of different places, and I do not know of any opposition, and I've spent some time talking to people about it. So what the legislation before you would do is simply establish this office in the Department of Administration, Department of Finance and Administration. It would, as a practical matter, be run through their budget. The legislation would allow this the coordinator to hire people on a contract basis. He's told me he has 2 people picked out he would like to hire as soon as he legally can do so. That's what the bill does. If there are questions, I'll be happy to answer them. If there are not any questions, I'll entertain a motion. Senator Frazier moves title sufficient do pass. Is there any further debate? Are you ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Thank you. Let me mention this strange event at 4 o'clock. And I'm doing the best I can in what I consider an unusual situation. I had a telephone call, I don't mind telling you this, from Eric Clark several days ago, who said, I'm not sure how those of us here out in the hinterlands are supposed to get vaccinated when the vaccine is available for the general public. Why don't you do something to make that simple? So I thought that did make some sense, and what I was hoping to do, and what I do plan to do, is have available for members of the Senate just a presentation on how do I get grandma her vaccine, with a list of, as a practical matter, where is the vaccine available, what do you do, and on and on and on. But on my way to that, because the nursing homes are in line first, trying to figure out when vaccine might be made available to 75-year-olds. I started having discussions about nursing home vaccination. This is what I believe the situation to be. United States government and CVS and Walgreens, who I'm sure I'll refer to as Walmart repeatedly. Walgreens and CVS have been employed by the United States government to inoculate nursing home residents and employees. They have, as I understand it, vaccine. They have a schedule of when nursing homes will be vaccinated. Some of the nursing homes are scheduled for their first vaccination the last week in January, and I saw one even in February. It seems to me that is unacceptably slow. There is some question about whether there are enough vaccinators to go to the nursing homes and vaccinate. I'm told from a number of sources that there are pharmacists not employed by Walgreens and CVS. There are some emergency medical personnel. There are optometrists. There are plenty of people available who can actually give shots. And with training, a bit of training, can be told how to give shots in this environment. I mean, these are professionals who are trained. And so there's a disconnect. Well, I've set up this Zoom meeting at 4 o'clock with representatives from CVS, Walgreens, the Board of Health, the State Board of Pharmacy, and the nursing homes, just to try to get everybody together to figure out how we do this more quickly. I've told everybody I'm not looking for a villa and we don't have time for that, but apparently there's some logistical problems that ought to be able to be resolved. There shouldn't be any nursing home that hasn't been able to get its first round of vaccinations by a week from Friday. I mean, I just can't imagine. So my hope is that this Zoom meeting at 4 o'clock will take place. So what I plan to do is have these people call in. I'm going to sit in my office, and this is going to be on YouTube. My suggestion to members of the committee, and I'm sorry, I know this is not ideal, but if you have a question you want to ask, I'm going to ask you just to call Janet Trotter at the committee office, and she can come hand me the question and I'll read it out. That's not ideal. None of this is ideal. It was the best I could put together, but at least we will have this discussion which is publicly available. So that's what's going to happen at 4. My guess is this shows up, the YouTube channel shows up on the screen in this room, but I don't intend to be here, but the room's open and people can come if they want to. Thank you. I appreciate the committee's work last year. We're moving ahead, but you know, there's this pandemic, so it's different. Call me on the phone if you need me for anything. Oh, there's a good vice chair. He can read my mind. The motion to rise and report. All in favor say aye. All opposed, no. The ayes have it.